Now to a medical story that caught our attention, and you'll want to take note of too. Colorectal cancer. It's now the deadliest cancer for men under 50 and the second deadliest for women under 50. By the year 2030, just a few years from now, experts predict colorectal cancer will be the deadliest for people 20 to 49. That's in large part because the disease can develop silently without any symptoms, and it's in a later stage. So let's begin with two people who can help us learn more about what to look for. Joining us right now is Gina Wagner and Jennifer Rosenblatt, Senior Manager of Special Events and Fundraising for the Colorectal Cancer Alliance. Thank you both for joining us.
Thank you for having us.
Yeah, absolutely.
Thank you so much.
Gina, let's start with you. You are a colorectal cancer warrior, currently receiving chemo. But can you tell us about how it started? I mean, you were just a young mother, probably asymptomatic for a long time, two young boys. You fall into this, I say, kind of the fear category. Like 40 years old, everything's going great, and I mean, we see these stats, and this is staggering. I mean, talking about being the top cancer killer for 20 to 50, I mean, you fall right in where it says. Tell me your story.
Yeah, I was having some symptoms here towards the very end, and I was able to go in and see my physician. They recommended that I see a GI physician within the next 3 weeks. I got in and was told that they thought I was pretty young and very healthy, and they didn't think that anything was going to be wrong with me, hoping that it was just going to be, maybe needed to eat more fiber, or I had a small issue. So we were really hopeful that it was nothing major. And unfortunately, I was living life completely normal right before this, had no symptoms, was out with my children, my family. It was the middle of COVID, so it was a little bit different during those times, but the symptoms came on pretty quickly. And when they did, that was when it was already too late, and I was already stage 4.
Yeah, and for those people who don't know, a lot of the nomenclature of cancer, that is a later stage. That means it's already spread. It had already gone elsewhere. You didn't catch it. You weren't able to confine it. So you ultimately also had to advocate for yourself to get that colonoscopy, right, to learn the truth. What do you say to others about the part of the process? Like no one, like I always say, healthcare is great till you have to use it. Right? And you probably learned that yourself firsthand. Tell me about this self-advocacy that you look great right now. And here we are, 4 years in, stage 4. God bless you. And thank you for coming on and talking to us about it. But what have you done to fight for yourself to make sure you're here for those little boys of yours?
That's a great question. And I know Jennifer is going to talk a little bit more about some of the symptoms and the signs as we move forward. But I think know your body. If there's anything going on that you just don't feel is right, you need to speak up and you need to tell your physician. It is difficult because a lot of times they tell you you're fine. There's nothing wrong with the studies. Your blood work looks good. Everything looks great. You're healthy. But if you know something is wrong and you know that you're having some symptoms that are described for a note marker for colorectal cancer, you need to let your physicians know. And that's the same for any other type of condition that you have. I also really suggest that patients always do any screening that is suggested for the ages that are noted. I've had a mammogram. I follow all the policies and procedures that facilities offer. So if I would have been offered a colonoscopy prior to this diagnosis, I would have not been in this situation.
Jennifer, why don't you expound on that? What can people do? Let's take it two-pronged. Preventatively, like why are we seeing this jump? Is it diet? Is it this? Is it that? Is it is it environmental? And then B, what can you do? Like I've the guidance used to be 50 to get a colonoscopy. Now it's 45. I lost a father to cancer, esophageal cancer, so I actually had mine not that we want to talk all about colonoscopies, but that's real, folks. This is real talk. You know, I had mine at 41. I got to go back at 45 here soon. So, Jennifer, tell me a little bit about that. You know, what does this cause, and then, you know, what can you do if you find out you're a part of this unfortunate growing group?
Thank you, Brad. There's several different things that you should be looking for. And you did mention about the statistics, but it is worth mentioning again that incidence is rising at alarming rates in young adults, with more than 1 in 10 cases occurring in people under age 50.
Wow.
And symptoms to look for include a change in bowel habits, rectal bleeding, abdominal discomfort, weakness and or fatigue, or unexplained weight loss. And, as Gina mentioned, as you mentioned, a lot of times these symptoms are not seen until later in the diagnosis. So while a healthy lifestyle really helps with everything, sometimes it doesn't protect you against a disease like colorectal cancer. And so it's really critical that people get screened at age 40, beginning at age 45, talk to your healthcare provider about screening options. And then also knowing your family history and knowing the risk factors. For example, a family history of colorectal cancer, certain inherited genetic syndromes like Lynch syndrome, chronic inflammatory bowel diseases such as ulcerative colitis, or Crohn's disease, and even stage 2 diabetes. So those really are very important. And if you are experiencing symptoms and you are under 45, it is best to really bring it to the attention of your healthcare provider.
Yeah, and fight for that colonoscopy. I'll tell you, folks, they're hell, but fight for it. You know, it can save your life. What can people do, Jennifer? We've got an event coming up. How can people get involved?
We do. We're very lucky to have the support of the Chicagoland community, people like Gina, allies, and our very own Brad Edwards will be emceeing the 3rd annual Blue Hope Bash in Chicago on Friday, May 3rd from 6:30 to 10:30 at Galleria Marchetti. And for more information about that, you can visit colorectalcancer.org/BHB Chicago.
Wonderful. We're going to put that online too and get it out there. Bless you for what you're doing. Last word, Gina, to you. How are you doing? What's your prognosis?
Feeling very good. Yeah, I feel good today. I have a small surgery here this afternoon to help with an infection that I got because of all the treatment that I'm receiving. But I'm feeling wonderful, and I have a great team at Northwestern that's really helping keep me feeling good and keep me as active as I possibly can be with my 3-year-old and 5-year-old that I have today.
Prognosis, or do you not talk about that? Because who knows? Every day is a blessing.
Don't really
right?
talk about it. I mean, there's a lot of hope here, and especially because of the Colorectal Cancer Alliance and all the research they're doing to fund so many new clinical trials and studies. There's a lot of hope for all of us to have very long, prosperous lives. And so I'm so grateful to the Colorectal Cancer Alliance for what they're doing and the funding that they're providing to really create more resources and more drugs that we can utilize to help prolong our lives after we've been diagnosed with this terrible disease.
Yeah, and Jennifer, so thank you for the work you do there. And Gina, thanks to you, because we hear a lot about science. We do health stories every day. But to see a brave face like yours come forward with complete candor on your story, your fight, and then making time for us today when you got a surgery this afternoon, bless your heart. And I can't wait to meet you at that big event Friday, May 3rd. We will see you both then. Thank you very much.
Thank you.
Thank you.